Hello, I'm Cheryl Austin, Family and Community Health Extension Agent with the Cooperative Extension Program in Bell County. This is Class 6 Healthcare and You of the Live Well, Eat Well, Be Active with Diabetes series. As we talk about healthcare and you, there are some members on your healthcare team. Some of those healthcare team members might include your primary care physician, a registered dietitian, a nurse educator, an eye or foot doctor, a dentist, a pharmacist, mental health professionals such as social workers, counselors, therapists, pastors, and certified diabetes educators are all a part of the healthcare team. But there might be some roles that are missing. Can you see a role that's missing on this healthcare team on this slide? You got it right. You are the one that's missing from that slide. You are the most important person on your healthcare team. Most of diabetes care is self-care. Only you know how you feel. Only you know if you're eating a healthy diet. Only you know if you're being physically active. Only you know if you're taking your medication and taking it correctly. And only you know when problems are occurring. So you are the most important part of your health care and your diabetes management. If ever you need more information about diabetes self-management, there are resources for you. You can go to the American Association of Diabetes Educators and look for certified diabetes educators at www.diabeteseducator.org, or you can also look up registered dietitians in your area from the Academy of Nutrition and Dietetics, and that website is www.eatright.org/find-and-expert. For information on meal planning, you can go to the American Diabetes Association, www.diabetes.org. Search under recipes. They have information on meal plan examples. They have recipes that you can download, and they have food and kitchen tips. Another important part of healthcare and you is engaging your family and friends. No person is an island, as they say, and so whatever we are going through, it's not just us, and we don't want to go through anything by ourselves. As you manage your diabetes, you don't want to do that by yourself if you don't have to. If you have family and friends around you, get them involved in what's going on. Ways that you can get them engaged is through exercise and healthy eating. So, a person with diabetes is not the only person that needs exercise, right? Or that needs to eat healthy. So why not everybody in the family or our friends as well be a part of that process? It's going to be more fun and we can all be healthy together. So let's find ways to be physically active together with our family and our friends, go for walks together, have dance parties in the house, and let's find ways for everybody in the family, not just the person with diabetes, but everybody in the family to eat healthy together. What are those things that we can all cut back on? And then engaging your family and friends in your experiences and the changes, if any, that you need to make. Maybe that's a change that would help them out as well. I think we all could probably cut back on desserts, just as an example. And then our experiences as well. Communicate with them about what's going on. Plan meals for the entire family. Choosing, we're buying, we're preparing foods in a healthier way, again, for everyone. If we're experiencing any problems, or not just things that might be negative, but just talking about the positive things that are happening in our lives, we can share that during mealtime or when we're exercising together. Talk to your family about any medications that you have to take. Show them how to use that glucose meter. They might have to use it on you, or use it for you, take your blood sugar for you at a certain time. So show them how to do it so that they are not afraid of it and they understand how to use it as well. Talk to them about the medications that you're taking. Maybe they can help remind you if you forget to take medications at a certain time. And always ask for help. Don't be afraid to ask for help. If you're like me, I'm a very independent person. I don't like to reach out and ask for help all the time, but I am learning that people really want to support us. When we have a good support system of family and friends, they really want to help us out. So allow them to help you. It's very important to communicate your needs. On this slide, it has an activity where we get into small groups and we discuss our experiences that we have with families and friends. We're not able to do that right now on Zoom, but I did want to just share some tips with you about communicating with your family and friends and communicating with your healthcare team. So when it comes to our family and friends, we want to make sure that we're always open about our feelings. Share those feelings on how your family and friends can be supportive to you, but not just talking to them about your feelings, but also be a listening ear for what their feelings are. Remember that just like having diabetes is a change for you, it's also a change for your family and friends and for your support system. And so it's important for both parties to be able to talk to each other and share your feelings. Also, when you're communicating with your healthcare team, it's important to prepare for your appointments. So write down your questions in advance, whatever worries, whatever feelings, concerns you have, write that down ahead of time. Any changes, write that down so that you have all of that information with you when you have your appointment. If something is going on and you can't wait until your appointment, you need to speak with someone on your healthcare team, it's okay to contact them and ask them to contact you about that issue ahead of time before your appointment. When you're at the appointment, it's okay to bring someone with you. Maybe there is a supportive family or friend that can come with you. Sometimes we don't always hear everything that's said at the appointment, and having somebody there with us to help us remember what the doctor told us or what the nurse told us is a good thing. Also, bring paper and pencil so that you can take notes yourself and ask questions as you go along. The last thing I want to talk about healthcare and you is what to do if we're experiencing high blood sugar or low blood sugar levels. If you're experiencing high blood sugar levels and you have a certain prescription medication to take, it might be that you need to take your medicine as prescribed, or it might be that you need to eat less carbohydrate foods during mealtime, or we might need to get in some physical activity that is directed by your medical provider to help bring that sugar level down. If we're experiencing low blood sugar, some symptoms you might be experiencing with that are shakiness, nervousness, irritability, chills, confusion, low energy. But the best way to know if you are experiencing high or low blood sugar is to check your blood sugar. If it's too low, you can drink 1/2 to 1 cup of juice, skim milk, or 1/2 cup of regular soda. You can also chew 4 to 6 hard candies, not sugar-free. This is not the time to go with the sugar-free. You want the regular type of hard candy. You could also take 3 to 4 glucose tablets, or you can swallow a tube of glucose gel. Then check your blood sugar again in 15 minutes. We call this the 15 to 15 rule. You get 15 grams of carbohydrate, and then you check your blood sugar again in 15 minutes. If it's still too low, then you're going to consume some more sugar. And if the symptoms don't stop, then go ahead and call 911. If your blood sugar returns to normal, then return to your regular schedule of eating your snacks and meals. Thank you again for participating in Live Well, Eat Well, Be Active with Diabetes. Again, I'm Cheryl Austin. I'm with the Cooperative Extension Program in Bell County, Family and Community Health Agent. If you have any questions, I can be reached at slaustin@pvamu.edu. I hope you have a great day, and thank you again for joining us.